Thank you very much indeed, Sophie. Can I firstly acknowledge the traditional owners, the Ngunnawal people, and also say that for me as Health Minister, closing the gap in Indigenous life expectancy is of the highest priority. I've recently come back from the Kimberley where we had a suicide prevention roundtable, and that only enhanced in my mind the importance of this issue. Can I also acknowledge all the patients in the room, some for whom it would have been quite a difficult job to get here, and recognise your struggles, your difficulties and your intense interest in the health system. And as the wheels of bureaucracy turn slowly, we all know they do, I do very much have the thoughts and the meetings that I have with many of the patients, particularly with cancer, and looking for that next treatment. Your stories are very much in my mind because you are a perfect example of the reason why we build the health system that we do and how, as Sophie said, we always must put patients at the centre. Richard, can I thank you and your team for the offer to be here today. And this session, or the sessions that I see that you've been having, are an opportunity to challenge the way we all think about cancer, to discuss new approaches and identify ways to improve the lives of the tens of thousands of people diagnosed every year with the rare and less common cancers. I understand how a diagnosis of cancer can devastate the person concerned, their family and friends. It forces us, of course, to face our own mortality and brings with it a raft of questions. Some questions we can answer, but for others, there just isn't the certainty. I'm here today to tell you that the Australian Government is absolutely committed to cancer control and has invested heavily in prevention, early detection, treatment and research. In cancer prevention, for example, through our tobacco control strategy, we've successfully reduced our smoking rates, and our work in this area is internationally well regarded. But today isn't about preventable cancers, it's about the cancers you get and that just seem to be incredibly bad luck, and about the determination of our health system to address those concerns, given the smallness of number when it comes to so many of the big diseases, I suppose, that governments are involved in helping with access to treatments. The government funds 3 national cancer screening programs, which I suppose are the centrepiece of our overall strategy for cancer. Bowel, breast and cervical cancer. We've just had passed through the Parliament the National Cancer Screening Register, because we all know that early detection does save lives, and as time goes on, I would like to see, and we do expect, other cancers to be added to that National Cancer Screening Register. Access to medicines, particularly the breakthrough medications that show great potential in fighting cancers, is incredibly important. The Australian Government, and that means taxpayers, are significantly invested in the fight against cancers. In fact, last financial year, $1 out of every 6 spent on medications listed on the Pharmaceutical Benefits Scheme was for cancer medicines. That represented $1.8 billion for 115 medicines listed on the PBS. Advances in treatments and medications are happening all the time. We constantly review new and emerging medicines to confirm they're suitable for use in Australia and consider expert advice on whether they should be listed on the PBS. Since October 2013, we've approved over 40 cost-effective medicines for the treatment of cancer at a cost of over $2 billion. This includes new treatments for rare cancers, including advanced pancreatic cancer, rare giant cell bone tumours, and advanced cervical cancers and gastric cancers. In the case of the medication denosumab used to treat giant cell tumour of the bone, this was listed less than 80 days after the Therapeutic Goods Administration approved its use for this condition. A fast listing, I'm sure you'll agree. Bevacizumab had its PBS listing extended on the 1st of September this year and now provides an important option for women with advanced cancer of the cervix who cannot be treated through other means such as surgery or radiation. These PBS-listed medicines can cost hundreds or even thousands of dollars each time they are dispensed, but patients with concession cards pay $6.20 and non-concessional patients pay no more than $38.30. The process of assessing whether a medication should be listed on the PBS is a comprehensive and independent process, and rightly so. The Pharmaceutical Benefits Advisory Committee is required by law to consider the safety, clinical effectiveness and value for money of a medicine being considered for listing on the PBS, both for its proposed use and as compared with other available treatments. This ensures that our scarce health resources are used widely and wisely. The committee brings together significant clinical, health, economic and pharmacological expertise. It includes an oncologist, a haematologist and a paediatrician who are experts in the treatment of cancer, as well as a consumer representative. The committee also welcomes input from patients, carers, members of the public, health professionals or consumer interest groups on the medications they will be considering. They also hear from patient groups prior to each meeting, which means their recommendations for listings must also take into account this important feedback. The committee's advice to the government is made independently. We do not interfere in the committee's advice or recommendations. From time to time, pharmaceutical companies may apply for Australian marketing approvals and listing of their new drugs on the PBS, based largely on their own commercial decisions. And sometimes pharmaceutical companies may choose to go to larger markets first, such as Europe or the US, which means delays in accessing these medications in Australia. However, we recently announced significant changes to the regulation that will result in faster access to these new drugs and treatments. The Australian Government's recent response to the recommendations of the Independent Review of Medicines and Medical Devices will go a long way towards reducing red tape and streamlining access to medicines and medical devices without compromising the safety of Australians. The Therapeutic Goods Administration, the TGA, is implementing 2 new expedited pathways that will help achieve earlier access to vital and life-saving medicines that address unmet clinical needs for Australian consumers. Priority review will enable certain medicines with a full data dossier to be assessed by the TGA faster, while continuing to ensure medicines meet the same high standards for efficacy and safety. Provisional approval will allow certain promising medicines to reach patients earlier by allowing these medicines to be provisionally registered for a limited duration on the basis of early clinical and safety data until full data is supplied and evaluated. This could mean life-saving breakthrough cancer medications will be available in Australia up to 2 years earlier than under current processes. The TGA will also make greater use of assessment reports from comparable overseas regulators to help bring medicines to the market earlier in Australia. The TGA will still have the final say on whether the medicine should be supplied in Australia, making sure that it is appropriate for the Australian context and meets our existing high-quality safety and efficacy standards. The reforms will be progressively rolled out over the next 2 years, with some of the new processes for medicines in place within 12 months. Australia has a world-class health system, and our cancer survival outcomes are among the best in the world. Our 5-year relative survival rates for all cancers combined is now 67%, but the rates for individual cancers vary. But in the medium to long term, research remains our best hope of beating rare and less common cancers. Ongoing research is crucial to better understand and ultimately find cures for cancers, particularly those that are less common or rare. You may be interested to know that the Australian Government is the single biggest investor in cancer research in Australia. Through the National Health and Medical Research Council, over $2 billion has been provided for research into cancer since 2000. Cancer Australia's research audit reports that between 2003 and 2011, there was a 291% increase in funding for research projects and programs in specific rare and less common cancers, up to $64.9 million. This included $8.3 million for research projects and programs which combined the study of multiple rare and less common cancer types. A further $33 million was awarded to projects which combined the study of a rare and less common cancer type with a more common cancer type. We've also invested in building our research capacity and infrastructure with funding for the study of rare and less common cancers by up to 60% between 2006 and 2011 to $41 million. An additional $15.5 million has been awarded over this time for initiatives which combine the study of multiple rare and less common cancers, and an extra $80 million to build research capacity and infrastructure where rare and less common cancers were combined with the more common cancer types. Cancer Australia is also working to support people with rare and less common cancers. Its priority-driven collaborative cancer research scheme has helped to fund or co-fund 82 grants for research into rare and less common cancers since 2007, worth almost $30 million. It also runs a Support for Cancer clinical trials program with funding to support Australia's 13 multi-site collaborative national cancer clinical trials groups to undertake important work in developing cancer clinical trial protocols. 9 of these 13 groups include rare and less common cancers, including pancreatic cancer, ovarian cancer, and brain cancer. And while we may not have found cures for every cancer, it's still been money very well spent, as it's making inroads into the fight against cancer. Our government is set to increase its medical research investment through the $20 billion Medical Research Future Fund. The fund will provide vital dollars for future health and medical research initiatives, up to $1 billion a year when it matures. Public consultations have recently been held to help guide the decision-making process to determine which research projects will receive future funding. I can tell you that through this process there have been a number of submissions about the importance of funding research into rare diseases that have a devastating impact and low survival rates, such as brain cancer. I want to take this moment to commend Rare Cancers Australia for its ongoing work in this area, for raising much-needed funds, for improving community awareness, and for supporting people with these rare and less common cancers and their families. Your innovative mobile app, Can.Recall, helps reduce stress in cancer patients by helping them to better understand their diagnosis and treatment and support the discussions they have with their doctors. Your Rare Cancers Patient Support Program provides an online directory of more than 200 rare and less common cancer types and lists Australian cancer specialists and multidisciplinary teams with expertise and interest in rare and less common cancers. This is an invaluable resource for the people that you support, and I'd like to say thank you. I'm sure every person who uses these great tools feels the same way. During the election campaign, we also pledged to fund further research into rare and less common cancers. During the campaign, the Prime Minister announced support for a $20 million investment towards childhood cancer research through the Zero Childhood Cancer Collaboration Network, which draws on cutting-edge technology to improve survival and quality of life for children who currently have no cure for their cancer. Our funding will allow for the establishment of a national network which will connect clinical and research cancer centres across Australia. That network will be used to map the molecular and genetic structure of tumours, responses to treatments, and share treatment results. The data collected will speed the urgent diagnosis and prescription of treatments for high-risk childhood cancer patients. We will also commit $7 million in funding to increase the number and value of clinical trials in Australia, including improving access to these trials for adolescents and young adult cancer patients. Our long-term goal is to save lives by finding cures for cancers. But in the meantime, it's also important for patients to have the care and support they need to understand what's happening to them and the difficult choices they face. So I thank Rare Cancers Australia for being there to help support Australians in their time of need. And I wish you every success with your Sick or Treat sessions today. Thank you.